So just to welcome you all again, I'm Kevin Gilbert. Pronouns are he, him, his, and I am coming to you from the unceded territories of the Silks people in the Okanagan. And I am from an external team at Domain 7 as your MC facilitator host today with my teammate Lance, helping Foundry along. And Lance, I wondered if you'd like to introduce yourself.
Thanks, Kevin. Good morning, everyone. Good to be with you. My name is Lance Odegaard, he, him, and I'm calling in from the traditional unceded territories of Musqueam, Squamish, and Tsleil-Waututh First Nations. Grateful to be on the land here this morning in a very sunny Vancouver, and look forward to this morning. And I think I'll pass it off next to Sarah.
Thank you, Lance. Hi, everyone. My name is Sarah Wood. I go by she, her pronouns, and I am also calling in from the traditional territory of the Okanagan Nation, which is the Syilx-speaking people, specifically what is known as today as Penticton, BC. I'm super excited to be here with all of you and share kind of what I know, my experience and my perspective of restrictions. This whole model and Foundry, and my title right now with Foundry is Youth Peer Engagement Coordinator. So I know that might just be a title to a lot of people, but basically what that means is I kind of bridge the gap between young people and what we do at FCO and make sure that everything that we do at Foundry Central Office is youth informed, which we will obviously get into in a lot more detail later, really what that means for us at Foundry and how that works. Thanks, RJ. And I'll pass it off to Steve.
Good morning, everyone. So awesome to see some familiar faces and familiar names. My name's Steve Mathias, and I am Sarah Wood's colleague at Foundry, and I have the pleasure of working with Sarah and our team on a daily basis. I am personally calling in from the ancestral unceded territory of the Coast Salish people, more specifically the Tsleil-Waututh, Musqueam, and Squamish First Nations. My family is a 10th generation settler family. We settled in Quebec, and I migrated out here to the West Coast back in the 90s and just never left. And one of the reasons I love being here is I can take my dog out with my wife for beautiful 5K loops into the forests, and like we did this morning. And it was just a really wonderful day. It's a bit hot here in BC, but we'll try to cool things down a little bit with our conversation today.
Thank you, Steve, Sarah, and Lance. I really appreciate those introductions. Just to set a little bit of context for today, we're in an interesting moment, aren't we? Here we are as the pandemic transitions into kind of a new season. It's summer here, and we've learned a lot through this pandemic. We've learned that we are full, entire, whole human people. Our physical health has been greatly influenced by COVID, and in the meantime, so has our mental health. And it seems like all of us are asking new questions this year about how to better care for each other. And this year, I've been blown away getting to know about the good work that the folks at Foundry are doing that's right in this sweet spot, right in this category, just trying to make it easier for young people to access care under the same roof in a way that's truly respectful and integrated. So today is a chance to lay it all out there, to learn more about Foundry, about the integrated youth services model, and to see what it might take to bring some of this to our communities. So we've designed this learning program today in a way that gives you lots of space to ask questions, hear stories, have conversations, and learn in a way that works for you.
I want to give you a bit of an overview of what's coming and what we're going to be looking at this morning. So the agenda for today, we've got some interviews coming up where you'll get to listen in on some, I think, really lively and informed conversations. Looking forward to hearing from Steve and Sarah. There'll be some polls, some chances to hear from you. We want to hear your voice, and we want to have opportunities for you to check in. You're going to have a few moments throughout the morning as well for some personal reflection so that you'll get in touch with your own thinking. We're going to have some breakouts where you'll get to interact with other people on the call. And then at the end, we'll have some Q&A where you can bring your questions forward, and Steve and Sarah will engage with those questions. Would invite all of us to be active participants this morning to create the space here for us to engage well. And so encouraging you to be present, if that means disabling notifications or turning on video if you're comfortable, but being an active participant by contributing during the breakouts and the polls, and being conscious, sharing the space with the other people on this call. And so we're going to move right now into a check-in. Kevin.
That's great. Thank you, Lance. So for this check-in, we want to introduce you to a little tool that is called Mentimeter. And this will be the way we do our Q&A later on this morning, as well as invite a little bit of your participation. So here's how it works. First, you get to pick which device you want to use. It could be your smartphone with a browser or a separate browser tab. And what you get to do is go to the web address menti.com. That's MENTI.com. And you can use the code that's visible on my screen right now, 1688-7894. And it'll be through this mechanism that we hear from you at different spots throughout the morning and receive some of your questions. So hop on over here. And we'll get started once we have a few numbers appearing on screen here. Yes, menti.com and use the code 1688-7894. Got a lot of folks joining up to the count of 16. That's wonderful. If you do have any questions about how to load this up, don't be shy about unmuting and asking for help or typing your question in the chat. And we'll make sure everybody is connected with this way of communicating. Let's give us a moment to join. Up to 29, you can see that number ticking at the bottom and these different emojis representing us appearing on screen. This is lovely. When we have a good threshold, I'll just advance to the question that we're going to ask. There are 3 questions for us as a bit of a check-in this morning. And with 38 joining, we're essentially at the halfway point. So let's move that forward. For those that are just joining, I'll just wait for our friend Alexandra to get connected to audio. Welcome to new joiners. We're just about to start an activity using menti.com. So you can pop over on your web browser in your desktop or on your smartphone and go to menti.com and use the code that you see on top of the screen. So here's our first check-in. It's simple. We are going to ask you this. Here we go. Okay, well, that is not meaningful. Let's try this. Are you present and participating? Is the first question for you. You have 18 seconds to answer. Are you here? Are you present? It's a way of just checking to make sure the technology is working. And if you think back to what Lance was asking us about, of just being ready to be present and participating in the conversations. Is that you? Are you here for that? I would just welcome you to give a bit of a thumbs up to that, and we'll see how this technology works. Time's up. We have 46 out of 46 saying yes, they're here for that. Great. A fun little way to see where we're all coming from. Where are you joining from? See about dropping your pin on the map and we'll get a bit of a spread. You know, in the chat, you can add if you're coming from a place that is not Canada, like Paul already did, coming from Dublin, or you just drop yourself in the ocean somewhere. And it's great to see these numbers already appear on screen. Strong representation in the lower mainland of British Columbia, a few throughout the interior. We're seeing some popping up in Alberta. We've got some in Ontario and Quebec. And this is great. Thank you, everybody. 48 participating on this slide. This is wonderful. It's great to see the spread. Yeah, Paul's off the map. Linda's in Delta. This is wonderful. Okay, the next question for us is as follows. What is one word to describe how you're arriving at the session today? What's one word to describe how you're showing up today? We'll see what people have for us. Great, you can see the words coming on screen already. We're curious, it's early, we're interested, we're refreshed, we're a little anxious. Thanks for sharing that. We're a little bit intrigued, perhaps we are tired, we're eager, we're excited, we're feeling rushed. Hopefully this is a space to catch your breath a little bit and just be part of this conversation. A little burnt, hopefully not burnt by people or burnt out, just burnt by the sun. We're learning, we're caffeinated, that's great. Grab the coffee. Hungry, okay, maybe you can go on mute for a moment and just grab yourself a snack. You are calm, you're hopeful, And you see just right in the middle, these three words that remain steady, the words that are representing what a lot of us are bringing: curiosity, excitement, and interest. We're ready to pay attention, ready to see what emerges today. We are mystified. We don't know what we've gotten ourselves into. That's a good word. Thank you for bringing your mystification. We hope to address the mystery. Happy to learn Foundry, pre-caffeinated, in other words, tired. That's wonderful. Folks, we have some lovely conversations coming right up. We want to introduce you. Well, you've already been introduced to Steve and Sarah, but we're going to set up a context where these two are going to have a conversation with each other, asking some questions about what exactly Foundry is here for, what it's here to do, and just hearing a little bit about their journey. So this is going to happen in two blocks. For the first block, which we're about to step into, Steve is going to interview Sarah while we listen in. And then after we do a bit of breakout conversations, Sarah is going to interview Steve. So this is a chance just to listen in, grab that coffee if you don't already have it. And over the course of these next 15 minutes or so, we're gonna follow along with the journey of Steve and Sarah. Anything you need to get going, Steve and Sarah, or shall we pass the mic over to you?
I'm ready if Steve is ready to ask me some questions.
All right, perfect. Well, thank you so much, folks. I will stop my screen share so that you can have the spotlight, and we'll look forward to listening in on this conversation between you two.
Right. So, you know, we're PowerPointed out, to be honest, folks. So we've seen a lot of PowerPoint slides over the course of the pandemic on Zoom. So we thought we'd kind of change this up a little bit. And Sarah and I have known each other for a couple of years now. I met Sarah back in, I think, 2017, maybe 2018, Sarah, 2017, I think, at a fundraiser in Penticton, I think, if I remember correctly. And we certainly have stayed in touch over the years. And then Sarah joined our team last year, which was really exciting. And so over the next 10, 15 minutes, I think you'll get to understand a little bit of Sarah's journey. And then over 10, 15 minutes in a second block, you'll understand a little bit about Foundry's journey. So I'm just going to start with some questions for Sarah. Sarah, we say the acronym IYS, and well, I'm just wondering if you can explain what IYS is and what it means.
Yeah, I would love to explain IYS. Definitely from my experience, I feel like I've known about IYS longer than I've been putting a label on it, just because it's been what I've kind of known and been working towards since I was in grade 9. And I'm 19 now, for reference. I know some people guess my age. I'm 19 right now. And I started doing youth engagement work when I was 15 years old. So IYS stands for Integrated Youth Services. And I feel like the best way to understand this is really just by feeling our own experience. We've all lived this already. We all understand how this works and why it is important. So I feel like for me, it really started with looking at the barriers that were put up when we were allowing youth to access care. So transportation, cost, stigma, language, delays to access, confusion on where to even go, youth friendliness in spaces, overburdened specialty youth mental health services, limitations to meaningful engagement. And these were all things that I was living in high school, and I was seeing around me, and I was seeing the consequences right in front of my face, and people struggling around me. I was struggling myself, my family, and where do we go? I live in a small town. There's only 40,000 people, which is relatively small. And even here, it is very difficult, or it was very difficult to figure out, where do I go for these services? They're across town. Maybe I can't afford to get there. I'm confused on what I'm going to find when I walk in the door. I'm incredibly anxious. I don't even want to get started in the process because it's just so confusing. So I'm just fizzing, I'm bubbling away with all of my peers, and there's just really no hope. And then I remember kind of one day it all came to fruition. I was sitting with my friend Hassan, and it sounds a little dramatic, but we were reading the newspaper, and there was an article, and the title was "A Spike in Youth Mental Health, a Crisis." And we were reading it, and we just felt incredibly frustrated, which may have been the wrong feeling, because we were like, yeah, we're reading this, but I've been living this already for years, and what the heck are we doing about it at this point? Because it just feels so overwhelming to even start the journey to go out your front door and be like, how am I going to support myself? I'm just not even knowing where to start. So that's where IYS came into the picture and completely changed my life personally. And I intended to really elevate this because I thought it was important. And I hope that it has also changed the lives of those in my community, which I feel like I have seen since Foundry's been in Penticton for a few years now. But getting into IYS, I know like we did a presentation a little bit ago, and there was a model that I really liked where it was above a door. So when we're thinking about, just picture like 10 doors in front of you and you're feeling lost and you're just finally ready to take the first step. And above every door is a different service that you're going to need from age 12 to 24. At some point, every young person is either going to want income assistance, housing support, support for employment, foster care transition, food security, walk-in counseling, sexual health, peer support, family support, primary care, substance use, and mental health support. So these are all things that at some point, young people are going to need access to one, if not multiple of these different services. So why not have it all in one space, informed by young people, what they're looking for, genuine to them, so that when they're going in, they're not confused about what are they going to find when they go in the door. They're going to find exactly what they need and what they're looking for. And it's been informed by their peers. Maybe it's been informed by them personally because they've gotten that opportunity from their community to inform this IYS model being integrated and making that just so genuine and authentic to take away all those barriers that mentioned earlier. So that's kind of what IYS is to me. It's huge. You know, it's everyone's lives, everyone's experiences just being integrated into these service hubs, which is, you know, we try and get away from terms like one-stop shop because life is really a journey, but it's providing life and support for every single corner and everything that we could need in our lives just to have those smooth transitions in the age, hopefully preventative care, right? 12 to 24.
Yeah, and Sarah, you know, you talk about like just all of these doors and all of these issues, and certainly as a young person, it can be really difficult to navigate, right? And try to get from one place to another. And you know, I think my reflection is that often we would give people, you know, I would be providing mental health care because I'm a psychiatrist, and a young person would talk about struggles with substance use, and I would give them a card, business card, because I knew the counselor. And I'd say, if you go see this guy, he's awesome. And here's a phone number to call. And it was like 2 blocks away. And guess what? They would never show up. They would just never show up because that's not how we work, is it? Like, that's just, can you trust someone if on a business card? Like, what's that like for you as a young person when you're handed a business card and say, call this number?
Yeah, and that's not really honestly, how we work as young people nowadays. Most of the way we access our information is on social media. So if someone handed me a business card, I would probably try and find their online information before I even thought about just walking across the block. So yeah, that's another way that we approach people, just having it all in one space. It's just so much simpler.
Yeah. And how about brochures? You guys pick up brochures all the time now? Do you still use brochures?
No, not since I was in my high school counseling office, but I think they were a bit dusty.
Great. So, you know, take me back a little bit. Penticton applied for Foundry back in 2016, and it wasn't one of the first communities selected, although it was an amazing submission. And then in early 2017, we let Penticton know, and I'll always remember, you know, those few weeks that Foundry was going to come to town. And so I'm wondering, what was that first contact with Foundry like for you? Like, why did it feel like this was the right thing?
Yeah, I remember that first day that we met specifically. It was just in one little building in an old historic building in Penticton, and we met with the Foundry team, and it was just our smaller size youth advisory. And like Steve said, we weren't the first group, so we had already been kind of advocating as a group. We were called the Yes Project, which stood for Youth Engagement Strategy. So that's when we met them for the first time, and they came and they were presenting, and it really all just made sense, and it all fell right into place. Like, this is what we have been advocating for. This is what Foundry is going to bring us. And this is why it just fits so perfectly together. But I remember I was a little hesitant at first because, you know, we were kind of rolling with our own thing and it was going well for us. So maybe we could do this on our own if Foundry kind of has their own model and their own thing going for them. And maybe we're a bit hesitant to those things, but it was 100% a conversation. I remember being asked the littlest things like, how do these colors make you feel? Does this feel too hostile to you? Do you like the blues and the greens? Or how would this look in Penticton for you? Where would you want to place the chairs? And what would make your peers feel comfortable walking through the door? And that's why it made so much sense to us, because that's what we wanted. And that's how Foundry approached us. And from then on, we were involved in everything. And I even had a sledgehammer knocking down a wall in our Foundry Center. So just co-designing from beginning to end. It meant so much to us.
Tell us about the finished product. What was it like? So a little history. Penticton was unique. It was the first time that we're aware of that the local community foundation bought a building. And so instead of fundraising for the Foundry initiative initially, they fundraised to buy a building, a 3-story building in downtown Penticton, where a bunch of agencies, social service agencies were on the 3rd floor. The 2nd floor was for Foundry, and I think the basement is for amenity space. It used to be, I think, an old Boston Pizza or something like that. But tell me about what was it like to walk in for the first time when you walked into Foundry Penticton?
It was definitely surreal, and I still have videos on my phone, like tons and tons of emotion, because like you said, we had been fundraising for years, and even my friend and I had been fundraising for years ourselves, and we raised over $20,000 in 4 years doing events with youth in our school for Foundry Penticton. And then we did a big pitch to the city, which really helped us with our down deposit. So it was years of culmination of work, and walking through the front doors and seeing like renovations underway. I remember when that was happening, it was incredibly overwhelming, but just seeing it all come to fruition was amazing. And even through COVID, just seeing how they've stayed strong and really been holding, because I know for other Foundry centers, it's been even shorter time that they were open since COVID hit them, and we've kind of had to shift. But being able to see and hear from my peers that they access Foundry, and just when I'm scrolling through my social media and I see people that I knew years ago were just kind of sharing or talking about Foundry, that's how I know, it worked. It all makes sense, and I can see it in my life, and I'm not the only one kind of pushing or talking about it anymore in the community. And other people are still carrying on that legacy, and I can see it. And even my peers go there, access services. I still access services at Foundry Penticton. So yeah, still very much in my life.
Foundry Penticton has been a real important addition, obviously, to Penticton and to young people. But there's just some interesting little tidbits about Foundry Penticton. It was the first Foundry to have TikTok and to do a TikTok video, and it was also nicknamed the Houndry. Maybe you can tell me why it's been nicknamed the Houndry.
Yeah, we call it the Houndry because I think it was our opening day, but we had more dogs than people at our opening presentation ribbon cutting ceremony. And the newspaper photo, there's just all of our pups. And every time you come into Foundry, we know our dogs kind of by name in Penticton, I guess. There's like a little community of pups at our Houndry. Makes everyone feel comfortable. We've asked young people tend to like animals more oftentimes than not and feel comforted by our puppies up front. Yeah, I know it's a pretty unique space. We have a very large basement, which we have a lot of opportunity to have youth events in, which kind of brings them into our space for other reasons other than accessing services, which can be helpful to kind of use that anxiety and coming into the space and recognizing it. Maybe you've done a yoga class here, or you've watched a movie or done a study session in our space, so it feels less daunting if you want to come in for sexual health or substance use support in the future. So, yeah.
And Sarah, you talked a little bit about the advocacy you guys did. I heard you mention that you guys did a presentation to your city hall. We often think about healthcare as being a provincial issue, but we know the federal government has supported our efforts at Foundry, our provincial government, but boy, the cities the municipalities have just done some amazing work when they've felt connected to the project. You also talked about fundraising, to support Foundry coming to your town. I'm wondering about some of the haunted house you guys ran. Was something that always really left an impression on me. Tell me a little bit about the haunted house and how that emerged and what you think that did for your community.
Yeah, so that emerged. I think that the most important part is that Hassan and I found kind of in grade 9. Hassan's the name, he's my best friend, and we kind of did all this together. So I have to give him the credit where credit is due. It wasn't just me, we are definitely a team. But we kind of went through grade 9 and we tried to do this haunted house, and it was kind of a disaster. We made a couple $100. It was pretty chaotic, and it was just through the hallway of our school. We asked them if we can have some after school time. We had to get a bunch of adults to sign up and supervise us so that we can charge a toonie for people to come through, and got all the costumes from Value Village. And our goal was pretty small at that time, and we just wanted to raise some money for the Yes Project. We didn't really know where it would go to, but we knew we wanted to fundraise for it, and we would have a building eventually. So that's kind of how it started. And then around grade 10, we realized that we really needed to build a foundation and have a backbone behind us. So we ended up having a committee of 50 young people in our school, and we created a youth advisory within our school, separate from leadership classes and everything, just a group of eager young people who wanted to plan fundraising events and raise money for this building, Foundry, Yes Project, whatever would be there eventually, kind of just the goal in mind that we were going to be supporting our peers in the future. And from there, it really snowballed, and we tried to, reaching out to everyone in the community. I feel like there's a lot more community support that people don't take advantage of sometimes, and that's how the haunted house is really what brought a lot of people's knowledge to Foundry, because they were excited about what we were doing in our school and seeing young people fundraising and doing these big events and really planning everything, and the acting and the costumes, the hair, the makeup, and all those things. Whatever folks were interested in, that's how they came and showed up and supported. And we built a team through that. And then, make a long story short, there's a million things that have to go into that, obviously, but reaching out to local newspapers, just posting on social media, advertising, and things like that, and making it very clear that it is youth created beginning to end is very intriguing for a lot of people. And we were able to kind of build a name for ourselves. And in the last year, we planned a haunted house, and we also planned a drag show for our grand finale in grade 12. And through those 2 events, we raised $15,000 in our last year. And then I think we ended up around 25, which was amazing. And we were able to donate that to Foundry Penticton, and kind of as like a donor for one of the talking rooms there. So super special. And now there's one named after the Princess Margaret Youth Advisory Committee at Foundry Penticton for our donation. So yeah, and I think that taught me a lot. And that really relates to the job that I do now at Foundry, which is youth engagement, and just asking young people to show up however they are and inform how they choose and offer what they can. And you can really make something happen by doing that.
Thanks, Sarah, and thanks for sharing that. I'm going to turn it back over to Kevin.
Thanks, both of you. That is fantastic to hear your stories and just hear some of the insider scoop for how a journey like that even happens. What I'd love to do is share with you a video walkthrough from Foundry Abbotsford. Sometimes it really helps to get some visuals. You got this image behind Steve, which is great. And what would it look like to actually take you on a bit of a tour through that space? So let me get this set up for you. And you can see a bit with your own eyes and hear with your own, what do you hear with? Ears is what we use. This is a bit of a tour of Foundry Abbotsford to help bring it to life.
Hi, I'm Jenny. Welcome to Foundry. Let me give you a tour. We offer services for youth aged 12 to 24. We focus on mental health, substance use, primary care, social services, and peer support. Let me show you around. So this is our reception area. This is where you'll check in when you first walk into Foundry. One of our lovely staff will help connect you to our youth health survey. As you'll notice, our waiting room is quite open spaced, but we also have a more private area in case you want to be alone. Over here is our donor wall. We recognize our community partners and our funders. As you'll soon notice, we have quite a few talking rooms, but this one's special for a reason. So some of our talking rooms are specified around cultural practices. So this one, for example, is used for smudging. This is another talking room. So we use this one for our walk-in counseling. So if you're ever here to see a counselor, this is most likely where you'll end up. And now you've entered our clinic. So we have quite a few exam rooms. I'll show you one of them. So here we have quite a few different physicians and nurse practitioners. What's neat about Foundry's clinic is that we focus on everything from mental health to the common cold. We have everything you need here. We also have trans resources for those that need it. Another thing that we have here is our gender inclusive bathroom, because we recognize we have youth from all walks of life here. And this is our community learning kitchen. So here we offer the opportunity for youth to be able to learn how to cook and other life skills they may need. This is our multi-purpose room. We have quite a few different groups that run out of here. We have our health and wellness group, our LGBTQ drop-in, as well as our youth and family engagement group. And we're back in the waiting room. There's one more room I want to show you. This is our peer support office. So this is where I spend most of my time. And if you ever need a peer support worker, this is the place to go. What's nice is that it's right next to the front door, so it's easy to find us. Well, thanks for stopping in. It was great to see you. See you soon.
Thanks, folks.
Gives a good glimpse into just getting to see the space. And thanks again, Sarah and Steve, for the glimpse into Sarah, your story. We want to give all of you a chance to have a bit of a reflection. So we're just gonna have 2 minutes here around a question. What kind of difference would it make if your community had a space like this? What kind of difference would it make if your community had a space like this? So if you want to grab a notebook, pen or paper, notes app, we're going to give you 2 minutes just to check in with yourself and consider what kind of difference would a space like this make in your community. Okay, 2 minutes. We're going to have a chance here to go into breakouts and to have a little bit of a discussion around this very question. And so a few moments, we'll get you into your breakout rooms and some instructions for your time there. Please say your name and where you're from, and then share your answer to the question. What kind of difference would it make if your community had a space like this? And then once you're done sharing, tag someone else in your group and make space for everyone to share their answers and responses to the question. We've got about 5 people per room, so you've got roughly 2 minutes per person to share. And so manage the time together as a group. Okay, so 5 people per breakout, 2 minutes per person, and we'll have a bit of discussion around this question.
Okay. It's amazing to see what folks are adding already. Thanks for taking the time to think through this and share some of the insights from your conversations. You can see in front of you what I'm seeing too, and I'll just read through some of these so we can see some of the themes. What we're seeing is that small towns are struggling in the same way, that long transit journeys are a theme. Even if another center seems close, transit could make it inaccessible. We're seeing how greatly needed IYS is across jurisdictions in Canada, and it'll look different across Canada under different governments, but the end result will always be positive for youth. It was interesting to see what's happening in other parts of the country, seeing that people across Canada are interested in having a Foundry Center. We're learning how to best promote IYS and gather community funds, support. We're seeing the importance of networking and relationship building, which can resemble trial and error. We'll make mistakes, we'll learn as we go. This statement that if there were more Foundry Centers, more lives would be saved. How do we sell the concept to decision makers? We're seeing that IYS has the potential to create real change instead of youth and family fearing the concept of re-explaining trauma or experiences to multiple professionals. All will be contained in one space. The enthusiasm of young people in starting one. Again, the theme of travel. Some youth have to travel quite long distances to access health supports. It takes a lot of energy. There's some similarities internationally in young people's experience of accessing support for their mental health. We're seeing that in Ireland, there's a lack of integrated services. The young people face the same barriers to support in Canada as they do in Ireland. Comfort, facilitating access. Young people are there to help that comfort and facilitate access to services. Here's a statement. Never thought about the fact that rural Indigenous communities don't have very many mental health supports. And as we have seen, generational trauma is prevalent in these communities from things such as residential schools. There's a need to really spread models like this. I think identity is important and to ensure the space feels welcoming for all youth, from Indigenous to LGBTQ friendly to all. As you can see, lots of really interesting perspectives emerging here. Lots of interesting insights, and we'll share this afterwards so you can read through them in depth on your own time. It's 10 o'clock and we want to give you a bit of a break from the screen now. I'm going to give you 10 minutes just to stretch your legs. You can come back at 10:10. In the meantime, just mute your video, mute your audio, and return ready to go. And we'll be excited to host you in the next round of conversations, which will follow a similar pattern of interview, reflection, breakout, and back to the main group. So get some coffee, stretch your legs, step outside for a moment, do what you need, and we'll be back right here at 10:10. See you very soon. Hi, folks. Welcome back from that brief break. And thank you for your participation and attention so far in this conversation. Sarah and Steve too, it's just been really wonderful to hear your explorations, and so lovely to see what folks were typing in the Menti about how the conversations went. It's wonderful. Getting a bit of an echo there. And Lance, are you back from your, yes, there you are. Let me hand the mic over to you.
Very good. Welcome back, everyone. Want to have a quick check-in as we come back from the break. I would love to hear from you here again on Menti. Very, very serious question here. Very serious check-in. On a scale of sheep, how are you doing as you return from that short break? Okay, so you can drag your dot and put it on which sheep most represents you. Number one, we've got a bit of a spunky one. Number two, very well dressed. 3 looks quite ornery. 4 coming in pretty cool. 5 defiant. 6 bounding. 7's a bit of an imposter, I think. And 8, well, 8 is absolutely zonked. Wanting to know how after that short break. It's great to see. We've got lots of bounce. It looks like quite a few cool characters there. A lot of number 4s, bit of tiredness. A surprising amount of imposters. Number 7 getting a lot of votes. This is great. Thank you, everyone, for adding your contributions there. Also want to ask a little bit more of a serious question. What are you curious to keep learning about? So priming a bit of your own curiosity as we move into the second half of today's meeting. What are you curious to be learning about? I'd love to hear from you on this as well. This is great. Thank you. We've got some good responses, good questions coming in already. What could the Foundry model look like in smaller, rural, geographically isolated communities? Where are Foundries going in the future? What's Foundry planning to do next? It's curiosity around how do we improve our chances to get a Foundry in our community? There's general interest in just wanting to know more about the IYS model. More interest in what's the future for Foundry. Here's a question of how to keep quality of care and quantity of care balance. How to get started in bringing the community together, how to make Foundry a reality in small rural areas, and who to advocate to ensure funding is available for this. There are some wonderings about the cost of Foundry services, learning about accessibility. Some really great questions here. Are the available support services the same at every Foundry location? So really helpful to know what you're wondering about, the questions that you're asking. So thank you for all of these. And again, we've got a record of them. So thanks for those contributions. We're going to move now into interview number 2. This time, Sarah's going to interview Steve, and look forward to another round here of conversation. So we'll pass it over to Sarah and Steve now.
Hey, Sarah.
Hi, Steve. The tables have turned. Awesome. I think that those questions really show they're very similar to my questions that I had, which is awesome. People are very curious to learn kind of how we are looking to move this across Canada, what that looks like in different communities, and scaling this further. But maybe before that, you can take us back a little bit to kind of your beginning with Foundry. So when you first started Foundry, kind of share a bit about what was motivating you, and if there was any initial barriers or resistances that you encountered when you
Okay, we'll start with the first one. So I was reflecting on this, what motivated me. So, coming out of psychiatry as a resident and being really excited to work in the community and helping young people, I started my career at Children's Hospital. And within about 3 months, I realized that Children's Hospital wasn't really helping a lot of youth in need. It was really helping more privileged families. And for me, I really wanted to see what I could do to help young people who really didn't have the privilege to access psychiatry in a timely way, or mental health in a timely way. So I went to, I changed to the St. Paul's Hospital, where I found a group of other psychiatrists who were really concerned about all the young people we were seeing coming through our hospital, who needed help and who had nowhere to go after they were discharged from hospital. And it's unfortunate that this model really came from that experience, but it is what it is. We really were wondering, like, where do all the homeless kids go? Like, we've got all these, like, we were seeing a lot of young people coming through St. Paul's, and this was in the early 2000s. And so we found out that there was this shelter called Covenant House, and Covenant House had over 50 young people in shelter every day. And they were seeing over 200 young people coming through their doors. And it was just a learning journey for me. I didn't know how large the homeless population was. I didn't know what their needs were. And so we started spending time with them. I started working in the soup kitchen and just getting to know some of the young people who were coming through. And they asked me if I would start providing some services to support the youth who were coming through the door. And I started to hear over and over and over again that they were coming from all parts of British Columbia, and that Vancouver, for many of them, was kind of like their final stop. They had just reached the end point, and homelessness was what they were struggling with. And among a lot of other things, including mental health issues and substance use issues, which had gotten pretty serious for them by the time we were seeing them. And so we started to build out a team. We started to build out this team working with Covenant House and seeing all these youth there. And I remember we were doing a phone call, like a radio show in 2012. It was a fundraiser for Covenant House. And Covenant House was talking about how they had this wonderful team of caring physicians that were coming into Covenant House, and how great it was that all these homeless youth could get help. And we started taking calls from around the province because it was a provincial radio show. And this lady called in, and she called in from my partner's hometown, Salmon Arm, which is a small town up in the Okanagan, probably about 25,000 people. And she said, I think it's great that you guys are providing this service. I'm wondering if I could drive my daughter down from Salmon Arm to Vancouver so that she could get help, because I can't get help for her here in Salmon Arm. And I think at that moment in time, it really, the shoe dropped for me, because I realized that, this town is 5 hours away. It's a 5-hour drive. And to think that a family would be was struggling so much to get help for their daughter, that they would be willing to drive their daughter down 5 hours, so 10 hours return, and drop them off at a homeless shelter just so that she could get help, just seemed incredible. And in a province that's as wealthy as British Columbia, it just seemed inexcusable that would be the situation or the case. And so my colleagues and I started talking about, like, what do we need? What do we, and we were working with shelters, so we were working with housing, we were working with income assistance, we were working with providing mental health and substance use supports, but like, no one's going to turn the tap off if we don't make a difference here. And so we started to really kind of talk about what was required, and where we landed was that we needed community solutions to this, and the same kind of stories were, like, it was all the same story. I tried to get help and I couldn't figure out where to go. I tried to get help, they told me I wasn't sick enough. I tried to get help, they told me I was there for the wrong reason. I tried to get help, it was a 10-month wait list. And so really what we did was we reverse engineered this. We just said, okay, so if you were going to build the worst possible model of care, what would it look like? and then say, okay, we need to come up with a model that's not that. And that's really how we came to be with Foundry. And we had obviously some influence from Headspace in Australia and Jigsaw in Ireland, which were two models that existed, but we really felt that we needed to take integration even further and to really include a lot of other services like sexual health resources and primary care, as well as the social services. And I think that that's what's made this model so strong, is that it's just really built from the community out. And so Foundry looks different in terms of the services offered and the people who are offering them, from community to community. But when a young person walks through a Foundry space, they know that they're in a place that's welcoming and that's really been designed for them. And that's what we're looking for. And it also means that when a young person is going to school in Kelowna, in Foundry Kelowna, but they go home to Abbotsford in the summertime, they just walk into Foundry Abbotsford and there's really no issue with getting help again, which is something we realize is that young people move a lot. And so we wanted to develop a model that was flexible and that was easily identified in terms of a place to go for help.
Amazing.
Sarah, I think you also asked, what resistance do we face?
Yeah, right off the bat, if there was any.
It was huge. It was huge. I think, without being able to show what this could look like, there was a lot of folks who were worried that they would lose their brand, or that their services would be threatened, or that there's no way that organizations could work together like this. There was no way that government would work with communities, that we could really shift the way things were done. Some people really felt that this whole issue could be addressed with $50,000 sprinkled in each community. And, we estimated that this was an $80 million gap in British Columbia, 80 million. Yet there was a gap in the kind of resources that we needed to adequately and appropriately help young people. And that if we're going to do something with $50,000, you're not going to help a lot of young people with that. And so that resistance was probably because I don't think folks could really envision what we could envision. And that's always a challenge, right? And so whenever we start talking about this in communities or in provinces, it's important to have that bold vision and to talk about what young people really need, not talk about, what adults think, they need and think that, we'll solve the problem. We really need to get to the root of what the issues are. And the truth is, if we were going to start all over in a community and build our services from scratch, right, we would never design our communities to support young people or seniors or adults the way they're designed. we just wouldn't. It's just too inconvenient and too hard to navigate. And so it's difficult sometimes for folks to really kind of grasp that what we're talking about is redesigning and transforming the system that exists to support the young people and their care providers.
Awesome. That's great. Thank you. And then I
Amazing.
think that we can kind of, how much time do we have? Do we have any time?
We can do like one more question, Sarah, if that works, if we keep it brief.
Maybe brief. I was just kind of regarding the questions and what the breakout room will go into, kind of what do you see as the future and how are we currently working to scale IYS across other communities and across Canada?
Yeah, so we're advocates for IYS, and we love that, you know, various provinces now are announcing their initiatives, and we're really interested in just sharing out just our experiences and hopefully getting to a place where we can all connect and interconnect. So, you know, someone say who goes to Foundry Abbotsford could go to Kickstand Red Deer and maybe show up in Air Montreal, and just thinking about that, just envisioning what that could look like. And so we need to share what's going on. We need to advocate for each other. I think that the federal government is very quickly going to need to think about the young people in a meaningful way, not in the way that they have in the last few years, which I think has just been, quite honestly, just hasn't really listened to the voices of young people and the needs that we're seeing in our communities. And so I think the future of IYS is bright. I really do. I'm really excited. I think within 2 or 3 years, we're going to see probably 30 or 40 of these across Canada, but we need 250 to 300. And that's what we need to do as a group of folks. We need to just continue to advocate for more of these services for young people.
Great, thank you.
That is amazing. Thank you, Sarah, for those great questions, and Steve for this storytelling of the journey you went on to really just notice what was missing and make these courageous steps towards imagining something new. It's really beautiful. What I'd love to do is invite you all to do a bit of your own reflection right now on this question. Where are you at with your own journey with IYS in your community? Integrated youth services, and what support do you need? I'll share the screen here so we can see the question, and it's just a chance again for a bit of personal reflection. You can grab a note paper or a notes app and just spend a moment or two, thinking about this, and then we'll move into breakout groups again to just sort of share some of this.
We're going to have an opportunity now to have a bit of discussion around this very question, and we'll go into breakouts once again and have an opportunity to bring your ideas forward. You're going to be with a whole new group of people this time. And again, about 5 people, 2 minutes per person. Try and manage the time in your group, and then we'll reconvene afterwards. But would love to hear your thoughts in a group setting here. Where are you at in your own journey with IYS and community? What support or additional info do you need? Okay, so we'll see you back here in about 10 minutes. Okay, I think, Kevin, do we have everyone back in the main room here?
Yes, I think all that we have are all that we have. We are here.
That's great. Well, we wanted just to take one more moment here for reflection and hearing back from you, and then we'll move into some Q&A where you can bring your questions to Steve and Sarah. But one more Menti check-in with you here. So we'll go to that slide. What was emerging in your conversations? So I want to just collect a few of the insights that were gathered as you talked and conversed with one another. We'll give you a few minutes here to gather some of those thoughts, put them into Menti, and we can gather them there. So just a couple minutes to put your answers down here. What was emerging in your conversations? Well, this is great. Hopefully you're already seeing some of these answers come in, but some really good insights gathered. What was emerging was hope. Love hearing that. Many more Foundry centers are needed throughout BC. We're seeing the importance of partnership working. We're noticing that different communities have different unique needs and challenges. We're hearing perspective from another province, being able to talk to local community leaders about value of a Foundry center. IYS need to include eating disorder services, accessibility issues and stigma surrounding mental health, substance use conversations. We're hearing money is key. Seeing the need for space, and the need for money. How do we convince people in power, specifically government, funders, that IYS is what youth want, need? We're seeing the importance of communities working together. Thank you for these. It's really great to capture them and to get them down. So thank you for adding all of those. We're going to move now into a bit of Q&A. Over to you, Kevin.
Thank you, Lance. All right, so folks, already there's been some really valuable questions coming in. You can really see the wheels are turning for so many folks here from the stuff that folks have shared in the chat and even in the Menti so far. What we want to give now is a space to really think through the questions you'd like to bring to the table here for Steve and Sarah to spend some time talking about with us. And we have right up until the end of our session together at 11 to get into these. So to help us populate these questions, what we're going to do is, again, give another short timer while some music plays to help you think back to the questions you'd like to bring here for the group. And after a little bit of time, we'll begin turning these questions over to Steve and Sarah. So we'll be back in just a moment. And again, you can use Menti here. If you're new to the call, it's go to menti.com in your browser or on your smartphone and use the code at the top and you can participate as well. And all of these questions can also be provided afterwards. So if you don't get time to go through all of them, we can still unpack them in a virtual way. So we'll talk about these after you get a little bit of time to reflect on what you want to ask. We'll resume in a moment. Right. Got 7 questions inputted. That's great. 11 now. It's a wonderful start and will give us plenty of material to work through. So why don't we take it right from the top? Our first question, as you're seeing right in front of us, I'll direct to Steve first. Are the support services the same at each Foundry location?
Kevin, so thanks for that question. And so what we have developed is sort of this idea of our core services. And these are from hundreds of young people who we spoke to before we launched the Foundry model. We heard from them in terms of the kind of services that they were looking for. And it wasn't an infinite list. It wasn't a huge list. It was really saying, you know, I look for help with mental health. I look for help with substance use concerns. But there was also word around, I would love to see my employment support be in the same space, or income support. I need some housing service or supports. So what we did was really develop this concept of core services. And so all our centers have the same core services: mental health, substance use, primary care or physical health, also peer support, which was something that we were really excited about building, providing young people with lived experience opportunities to work in our centers in a meaningful way as part of the team. And then our social services, I think, is really where the communities themselves are able to clearly define what resources are going to be in that center based on the needs of the community. And so the social services is really the social determinants of health, and so making sure that we have the services that young people need for the context that they're in.
Okay, thanks for that answer, Steve. That's really helpful. Let's see what else folks have. When's the next call for Foundry applications?
That's a good question. And so for those of you who don't know, in British Columbia, we were just told that in the last budget that Foundry would have another 4 communities join our network in 2023-24. And so we're still very early days because we just found out about a month and a half ago. And so we are in the process of having early conversations in our team and with government to just talk about when the next call would be and what that process will look like. And so we had a call just about 18 months ago, and learned a lot from the communities that applied. And so we're looking forward to understanding really what would be an ideal way of identifying the next 4 communities, understanding that we probably have another 30 to 35 communities that are interested.
Okay, interesting to balance the difference between funding available, communities that are interested, I guess sort of highlighting the need for the journey that you went on. You don't necessarily have to wait just for Foundry alone if there's a way to do integrated youth services in an existing setting, right?
Yeah, and so we encourage communities to continue to move along this way and use engagement means and other forms of really getting the conversation started. COVID was a great time for that, and we saw a lot of communities have conversations with their young people that they hadn't had before. Yeah. And so it's been really exciting to see. And we don't necessarily we ask that folks think about the conversations they can have before a Foundry emerges or before a Foundry call happens.
Right.
And so that's really important.
It's so much about the partnerships that get built, and those can be built right now, even if there's not an open call. It's perfect. Okay, here's a question. Cost of accessing a Foundry location, 3 question marks. Is it going to be cost prohibitive? Is it going to be expensive? Is it going to be affordable? How would you answer this, Sarah or Steve?
Sarah?
That's too money talk for me. You go. Cost. I'm all about engagement. I talk about the fun stuff.
Sarah's here for the people. What about you, Steve? What you got?
It's free.
Okay, free, no charge, doesn't even get billed to benefits. You can just walk in and use it.
That's right. That's how the services work. Yeah.
It's a really big gift. That's not common in other situations, eh?
Well, a lot of these services are free for youth or young people, with the exception of probably counseling. And that's something that we want to ensure that counseling is readily available. So all our centers provide walk-in counseling, which is typically, as much as we can, we try to make a lot of counseling slots available. So in some cases, as many as 15 or 18 slots available so that young people can access them on the same day.
That's remarkable. It's definitely not easy to access counseling services at such a cost and with such availability. Thank you for answering that. Here's our next one. Currently, there are no IYS eating disorder treatments. And why is that? We saw somebody reflect that in the recent Menti Checkin as well. Wonder if, Steve, if you have any comments on what you're seeing in that space, if you have any perspective there.
Well, actually, Foundry Penticton is one of our first communities to actually sort of identify this as a specified need. And so with our mental health services, we try to create pathways so that if a young person comes in and they're concerned about anxiety or depression or eating disorder, that we have a way of responding to their needs in a timely way, either locally or through our network. Or partners like Children's Hospital. So we know that eating disorders is coming up a lot. It's coming up a lot in our health surveys, and And when we ask young people what they're concerned about, we do hear eating disordered eating is coming up. So it's an area for us of important growth over the next few years.
Great. It sounds like you're definitely seeing the need. You're bringing some humility to it to recognize you don't necessarily have that whole question answered. You're seeing the need for partnerships and networks in the community, and you're taking some early steps, Penticton being an example of where that's emerging. Thanks for that answer, Steve. Here's a question. What initiatives does Foundry currently have for the future? How many years or months in advance does Foundry plan such initiatives? And is this available for the public to view? Sounds like you walked us through a little bit of that already, Steve, but maybe you'd like to speak to some of the heart behind this, which I think is one of like participation and visibility and transparency, just to see what's emerging and ways to be engaged.
Yeah, I was wondering, Sarah, would you be okay to comment on sort of the youth engagement that happens before Foundry opens and what it looks like? And
Yeah, I saw there was kind of another question that would relate to that too. Like, how do I even get young people interested in doing this? And I feel like my two biggest answers, like for initiatives that you can plan or things that you can do, is going into schools, number one. And then if you have the knowledge to do it right, I would say social media is definitely important, but it needs to be done right. So advocating or allocating maybe that responsibility to a young person to reach out to their peers would work incredibly well in getting young people out. They like to come with their friends first and foremost, so that they feel comfortable in this space. But the easiest way that I have found definitely is through schools engagement and online social media.
I'll say to this is that to get to open a Foundry, for us, it takes anywhere from 18 months to 3 years sometimes. And part of it, a big reason for that is the intentional engagement of community partners and engagement of young people, engagement of caregivers, but also organizations that exist in the community, including local First Nations partners, and to do that intentionally in a meaningful way, not to bring people at the table at the last minute and say, hey, what do you think? But to do it from the beginning and to ensure that our engagement includes a diversity of young people. And I think that that's something that we're quite proud of. It's to see the diversity of the young people that do come into this model and work with us to imagine what this Foundry can look like and what the services can feel like when it's finally open. But that takes time. And so we talk about this as an intentional generational project. You can't transform a system, or you can't transform your services with a wave, with a magic wand, or in 6 months. It takes a long time to do this, and so that's why we have a long runway when we do decide that we're going to work with a community to open a Foundry.
Great. I hear you highlighting the need for real close participation and engagement, patience and system change. And as much as Foundry seeks to be a force to help change the system and make plans, it seems like you're highlighting that it's not just top down. It's not just what does Foundry want and what are we planning, but it's how can you invite participants? How can participants see themselves as part of it? And how can partnerships get built that really could go a long way to increasing the speed, increasing the participation, and making it a little bit more achievable. All right, let's see what else we got here. A question here says, what kind of support does the central service provide to the Foundry Center team? I think that's describing how we have Foundry Central and we have the individual Foundry centers. So what's that relationship like, and what kind of support flows between those entities? Question for Steve.
Well, Sarah, do you want to talk about how we support youth engagement locally, and then I can talk about others?
Yeah, I was going to say, from my experience so far, at local centers, I was part of my local youth advisory committee. And then we also have provincial youth advisory committees for lots of different supports, like our content, different, like our research team, our services team, where they all have their own youth advisories and youth advisors that inform that work. And we kind of built out this whole network of communication and knowledge exchange and all of these things that are kind of constant relationships that we are building. And for me, it's part of just reaching out to local centers and maybe inviting myself to come to their youth advisory committees, meeting their staff, asking them, how can I support you with engagement in your community, move forward in a more productive way? Maybe what are we lacking in these communities? What are youth saying now? Because it's constantly evolving, constantly changing. So from an engagement perspective, that's how we manage those relationships, is meeting with their center engagement leads as well as our central office engagement leads. And we all work with young people in different capacities, but keeping those relationships consistent is definitely important.
Great. And Steve, did you want to add some of your comments to that question?
We have a team of about 50 or 60 folks that work with us as core members of our team. And that group of folks are content experts in a whole bunch of different areas. I want to sort of, I think really, because I realize we're short on time, I think it's important to talk about how we're trying to be different than historical colonial models of care. We recognize, obviously, we recognize the harms that have been created by traditional healthcare systems, and we recognize that we're part of that system. And so we have been, I think, as thoughtful as we can to create within our team an Indigenous wellness team with strong leadership, and a group of folks who are working with an Indigenous consulting group, reciprocal consulting, to really understand not only the training that our Foundry Central Office staff need, but also the training that all of our service providers need in their communities. And recognizing that our model has been designed out of dozens and hundreds of conversations with young people. Many of them have been Indigenous, self-identified as Indigenous, First Nations, Métis in our province. And so we've been shaped by those conversations. And so while we still have, I think, traditional medical services in our centers, we also deliver, I think, services in a way that is far more consistent with Indigenous wellness models. We have funding to support young people to connect to the local land, to get out of the city, to learn from elders, and to also prioritize their health in multiple domains, not only focusing on one. And I think that our journey is just beginning in that respect. We acknowledge where we have been and where we come from, but where we hope to go, I think, is really exciting. And I hope that one day folks will say to us that we're not a colonizing model, or we're not a colonial model of care. But I can't say that, and it will take time for us to get there.
Thanks for that answer, Steve. That's a really healthy way to end, I think. I'm hearing humility and intentionality from your part, conscientious efforts to build partnerships with community members and voices that need to speak into this, and an awareness of where this could go wrong. It's not just a sense of saying, we have the answer, let's install it. It's continuing to infuse those principles of co-design, respectful partnership, and humility, even in the care of it. And that even now, though you're doing what you can, you're still maintaining an openness to what might still need to change. Thank you both for being put on the spot in both the interviews and the Q&A at the end. And thank you to all of you who participated in this conversation this morning. It requires a lot from you. It requires attention, interaction, participation, questions, and you brought it. I'm really grateful for that. What we're going to do after this is share some follow-up resources with you over email. You'll get a recording of this session. You'll also get the slide deck, which includes all of your contributions that you added through the Mentimeter, as well as a list of questions. We'll do what we can to see if the Foundry team can take some time to type out some answers to the remaining 15 or so questions that you typed in, so those don't go to waste. And again, from the whole Foundry team, and from Lance and I too, just thank you for making this happen today. Thanks for being part of it and lending your imaginations and your hearts for how a model of care like this can continue to reach Canada and beyond, and just bring the hope and the up close partnership that's needed for this kind of long-term systems change. It's really meaningful. And we hope you have a great rest of your morning, wherever that may take you. We'll see you next time.